is that visual disabilities include anything that causes decreased ability to see, that's not fixable by correction glasses or medications. But that includes things like cataracts, glaucoma, macular degeneration, but it also includes things like binocular vision disorders, which essentially means that the two eyes aren't working together as one, and that is often hard to know that's happening, especially with children. So in school, they may have blurry vision, but they may think that everyone sees that way, or they might think that glasses will help, but glasses don't actually help because it's more of a eye teaming issue than a visual acuity issue.
That makes a lot of sense, because I remember sharing in my story earlier that for my daughter, she kept saying, these aren't helping. In fact, they were hurting her eyes. And we just kind of thought that, she needed corrective lenses to help her to stay on task or to be able to see the words on the page. But in fact, she could see words on the page as shown on the screen. I mean, I remember seeing this in your office and just being floored by it, because it clearly says that a child that sees like this can pass a vision screening. And in fact, that's what happened to her. She passed the vision screening, but the optometrist was just like, okay, well, maybe we'll just give her a small amount of prescription, which wasn't really doing anything, because she could also see letters reversed, or she could also see double. And so I remember this being the profound moment for me. So tell us about the population of people then that you often see with a visual disability. I mean, are there some people with a higher incidence of visual disability than others, maybe certain groups or certain economic status or classes of people, or, kind of help us with that in terms of the incidence rate?
Yeah, sure. So the population of people that are typically affected by visual disabilities, it doesn't really discriminate. I would say all ages can have issues that are hard to detect or hard to really understand where they're coming from. People vary so much, symptoms are very different. I would say children that often have these issues, they do present pretty early. Of course, since they're in school all day, they may have a lot of issues with blurriness or attention. A lot of children have issues switching back and forth and copying from the board. So there's lots of, copy work in school. You have to look at the board, listen to what the teacher's saying, and then also write those things down or read a book up close. So that can also affect children a lot. And I would say that children are definitely affected when it comes to nearsightedness, just because they do so much near work, and they're also on phones and tablets so often. And this is a thing that affects the whole population, really, is the constant near work. I'd say all of us are often on phones, holding them really close up to our face, or on a tablet, or even people who play video games might be very close to the TV. So that can cause a lot of challenges when it comes to binocular vision and being able to see something clear up close and also see something clear far away. So I would say it is children that are affected when it comes to that. However, vision therapy also treats people who have had visual difficulties due to brain injuries. So concussions, strokes can often have a big effect on vision and that eye teaming. So I would say we see children mainly with convergence issues or accommodative issues, seeing blurry at near and distance. When it comes to teenagers and middle-aged people, it's mainly concussions that we have to treat. And then once we get into the older population, it's mainly stroke. So there are people of all ages that do need vision therapy. So I wouldn't necessarily say there's a certain socioeconomic status that I've noticed or anything like that, but I would say I've seen people of all ages, all backgrounds, all genders that come in here, and a lot of them have very similar issues.
Yeah, that's very good. And I'm so glad you mentioned that. And you also talked a lot about concussions. One of the things in my own research, really researching this conversions insufficiency disorder, I realized that some of the common causes for that might be a brain injury or some form of brain trauma, or even something as simple as a concussion. And a lot of times, we often may, suffer some sort of injury, a fall, or whatever the case may be, and miss the signs of a concussion. Talk to me about how that can, raise the risk factor or the risk level for leading to, or somebody, getting some sort of visual disability if they didn't even realize they had a concussion and just kind of went on with their life.
Yeah, so we do have a lot of patients in that position. They'll tell us, oh, I think I might have had a concussion a few years ago, but I never went to the doctor. I never followed up on it. So people will often get a concussion. Some people might not think it is that serious and may not go to the doctor at all. Some people will go to the doctor, find out they have a concussion, and then just say, okay, well, I'll just take it easy. And most of the time, the initial symptoms subside pretty quickly, right? Within the first couple of weeks, you might have headaches or even dizziness and double vision and things like that in the beginning. But after a while, those symptoms may subside and you may have lesser symptoms that continue. For example, headaches, a lot of headaches associated with near work or working on computer screens. Things may just be a little more intense. For example, people often develop like light sensitivity. So it might not be something that you notice immediately that you're thinking, oh, this is because of the concussion. It might just be something down the road where, yeah, I just get headaches often, or I can't look at things too close for too long. And a lot of people don't realize that it is directly linked to vision and the way that your eyes are seeing and the way that your brain is trying to process this information. So,
absolutely. So I hear you saying the signs can easily be mixed. I think that I love that you're bringing up the idea that we are today so technologically driven that a lot of our work is done, by sitting in front of a computer or relying on some form of technology. And many of us do not realize that there are things that we need to be doing on a day-to-day basis to take care of our vision, particularly if we work, 8, 10 hours behind a computer. And even our children, for that matter, that spend a lot of time on video games, their tablets, their smart devices. Talk to me a little bit more about that as a vision therapist, what are some of the things that you do to treat some of these issues that I think are going to be with us, 21st century on, because technology is here to stay?
absolutely. So I would first say that we have a lot of people that we really do have to teach visual hygiene. Now, when I say visual hygiene, I mean things like we encourage our patients to take breaks, whether it be from reading, being on the computer. But since so many people have jobs on the computer where you're sitting down for hours, typing away, writing reports or making spreadsheets, you're looking at small fonts, and your whole work is at your desk, and you're not often looking far away. And we forget that is important to take a break, walk around, look far away. It is important to give your eyes some breaks from constantly being up close. And I think that's something new to, like you said, that from 21st century on, we're going to be dealing with this a lot more. So we encourage people to take visual breaks. So we encourage people to make the font bigger. On your phone, the font is really small. I know we've all gotten very used to it, but if you can, make the fonts bigger. Try to possibly lower the light on your devices as well. Lighting can really, I would say most people who have a lot of issues with light sensitivity it's almost impossible for them to work on a computer a lot of the times. So I would say, we lower the light on screens and things like that. And mainly taking breaks, looking far away. Let's see. We would also recommend that people use, um, let's see, additional tools to help if they do have like problems with specific things. So if light sensitivity is your issue, we do recommend that people try blue filtered glasses. I know a lot of people, might have thought for a while it was a hoax. I know people were really excited about blue light glasses maybe like a year or two ago, and then it kind of just faded off into the background. But I do think it is an important piece of keeping your eyes healthy. Another thing is not sitting in the dark on your phone or watching TV. I know my brother, he's always playing video games, and I'm always telling him, you got to have lights on around you. You can't just be looking at a bright screen and have it be dark everywhere else, because that can cause headaches and things like that. So those are a few of the things that we recommend people do, and that's just as a precaution, right? That would be for everyone. People with more specific diagnoses might have other accommodations that they need, but for things like that, or for most of the population, those are the things that I would suggest.
Okay, great. Thank you so much for that. I want to share with our viewers some of your slides here, and you can kind of tell us, a little bit about, what we're looking at here with each one of these, and I'll advance them for you as you give me the prompt.
Yeah, so I'll tell you a little bit about what vision therapy is from the baseline. We like to tell people all the time that the owner of this practice, anyway, Dr. Klonsky, or he was a previous owner of this practice, and he would always say, vision is more than 20/20. So there's a difference between seeing and having good vision. You can see perfectly fine and still have bad vision. So a person can have 20/20 vision in each eye. If for some reason they aren't able to use both eyes together, or what we call eye teaming, binocular vision, if they're not able to use those eyes together in a correct way, their vision is going to be less than favorable. We'll just say that. So some of the main things that we focus on in vision therapy are binocular vision, which is eye teaming, seeing both of the eyes together, or using both eyes together to see the image. We also work on tracking, which is essentially, the best example would be reading. If you're reading a paragraph, tracking would be able to keep your place all throughout the sentence, being able to find the next line and make sure that you're reading line by line, you're not skipping any words or anything like that. We also work on, depth perception, which is another subset of eye teaming, because without both eyes, we wouldn't be able to see depth in things. We need both eyes to be able to see depth. So if one eye is maybe being suppressed or not being used, or the brain is ignoring the input from one eye, and we're only using like our dominant eye, then we won't be able to see depth. So that leads to things like poor eye-hand coordination. So we also do a lot of physical activities, vestibular activities, eye-hand coordination activities, to strengthen the connection between our visual system and our body. Let's see what else. We also teach a lot of converging and diverging. Like I said, that's essentially eye teaming as well.
Say a little bit more, just for the benefit of people, I guess, who might be thinking about a conversion versus a diversion as it relates to your eyes. Like, what would that look like in practical terms?
Yeah, so I think actually on the next slide there's a little example.
Okay.
So this is what eye teaming is. Normal eye teaming, you can see both of the eyes are pointed and directed at the same spot on the page. So that would make for clear vision. Both eyes are seeing the correct perspective. Convergence insufficiency means that the eyes are struggling to aim close enough, right? So if we're looking at something up close that little triangle would have to connect on our target up close. If we're not able to bring our eyes in enough, or the connection isn't strong enough to move those eyes, move those muscles to bring the eyes inwards, then we'll probably end up seeing some double vision, because each eye is seeing a completely different picture, and it's trying to overlap that picture and fuse it, but we aren't able to fuse the image because they look different. So that would be convergence insufficiency, meaning that they're not able to converge up close. Convergence excess means that we are converging too much. So the muscles are too tight, they're bringing our eyes in too close, and we're actually focused on a point in front of our object that we're looking at. So that can also cause double vision, because we're seeing almost in front of our target. So that is essentially what convergence insufficiency and convergence excess is.
This is really fascinating to me, and I love the brain. And so when I see things like this, and I really talk about, just how important our brain really is, because it really helps to manage so much in our lives, and taking care of our brains and making sure that we are practicing good brain health regimen. Because when I think about things like this, and the idea that our brains know to make our eyes just kind of go together to focus in, but then there may be something preventing one eye from going in and the next. But it's fascinating to also learn that even if you have these disorders, help is available. And I think that that's the point that I really want to drive home here. These are tools that I've seen before. They excite me because it tells me that my own child is getting the help that she needs. Tell us what we're seeing on the screen here.
Yeah, so these are some of the main tools that we use in vision therapy. So I'll start with the Brock string, since we were talking about convergence insufficiency. I actually have one right here, one that we use in the office. So it's essentially a very, very long string. It's much longer than this, but we have 3 different color beads. And essentially what we do is we'll have the patient hold it to their face, and we will look at the different beads. So we're trying to expand the patient's convergence range. So we'll start out with the bead a little bit further, have them look at the bead and make sure that they're not seeing double. So if they're seeing double, that means that their eyes are not aimed correctly at the bead. So that's one way that we can ensure that we're working on convergence insufficiency, because you're either seeing the bead double, you might see the strings double or single, but it also depends what we're looking for and what kind of activity we're doing. We also have patches, of course. Patching is done for mainly patients who have amblyopia, which means one eye sees a lot better than the other. So some might call it a lazy eye. So we patch the quote unquote, I don't want to say bad eye, but we patch the eye that we patch the better eye, so that the other eye can have a chance to strengthen its visual skills more. So we use patches for that. The red-green glasses are some of my favorites. They're very interesting, and people are often quite excited by them. They are glasses with two different color lenses, one red, one green, and we have a bunch of different activities that we've modified to include those colors, red and green. And so what happens is, if you were to cover one eye, for example, if you're wearing the red-green glasses, like we have here, if we were wearing the red-green glasses and I cover my red eye and I'm looking at a red-green image, I would only be able to see things that are green, because I would be looking through the green side of the lens. So if we switch and I'm only looking through the red, I'd only be able to see the images that are red. So they cancel each other out.
I see.
So this is good for working on suppression. Some people, like we were talking about, may have a lazy eye, may have one eye that doesn't see as well as the other. Over time, that eye may become ignored by the brain. The brain is thinking, okay, this eye is not seeing as well, or this eye is causing us to see double because the alignment is off. So we're just going to ignore that eye. So that's why some people are only really using one eye to see. They may look completely normal. You might not even notice.
Yeah.
Lazy eye doesn't always mean that there is an eye turn.
Right.
Right. So if one eye is seeing better than the other, they may ignore that other eye. So this works on ensuring that we are using both eyes together. If we were not using both eyes together, we would not be able to complete the activity because half of the activity would actually go blank.
Yeah.
So when you're suppressing when wearing these glasses, one eye will actually kind of black out the other color.
Yeah. I want to say that the red-green glasses is so fascinating. And if you're just joining us, we're talking about the type of therapies that can be used to help you if you're having a visual disability that corrective lenses may not necessarily help you with. And I was about to say the red-green glasses, and again, the fascinating brain. I remember how excited my own daughter got about it, the red-green glasses, because she was doing something as it related to recall. And she remembered, well, the red ones were here and the green ones were here. So it even can help with comprehension and association and recall, all of those skill sets that can sometimes be interfered and interrupted when you have a disorder like this. So I think that the tools are highly effective and they're fascinating, and that we have to really understand the power of this form of therapy and what it can really do, not just for children, but for adults as well.
Yes.
I want to switch to your next slide. Tell us what we're looking at here.
Sure. So this goes into a little more detail about binocular vision. So you can see in the middle there, it says vergence. So that's what we were talking about before when we were talking about seeing up close, seeing near, our eye alignment changing to be able to see something at near. On the left there, you'll see strabismus, which is an eye turn. Some people may call it a lazy eye, but essentially this can happen for a variety of reasons. We see it most often in children. That's usually where it starts. With strabismus, it essentially means that the brain is ignoring that eye and the eye has decided to turn either inwards or outwards because it's not being used. So this can be corrected if we do find it early and if there are measures taken to try to strengthen that eye. So vision therapy, patching, things like that. It is also possible to fix it with surgery. However, we like to think of that as a last resort. Surgery is often more cosmetic than it actually fixing the problem. So that would be strabismus there on the left, and then amblyopia is on the right. And I know we touched on that a little bit too. Amblyopia is when one eye is much stronger than the other, and amblyopia can often lead to strabismus.
Okay. And here's your Brock string.
Yes, this is a picture of a girl doing the Brock string. So it looks like she's looking at one of those close-up beads, either the green one or the red one. So we'll often have them switch between them. We'll say switch from green to blue to red. So they're really working on those different distances so that they'll be able to switch when they're in a school environment or a work environment.
And I think the idea here that we want to drive the point home, as with any therapy, whether you're doing physical therapy or mental health therapy, I think the idea to remember here is consistency is key as well. Because one of the things you're doing is in this case, you're retraining the brain to do exactly what it perhaps for whatever reason has refused to do. But we have to be consistent and we have to be constant and also patient with processes like these that can be highly effective. I know you talked about nearsightedness, myopia before, and I think that this is kind of just a display here for us. One of the things I want to ask you, as we wrap up this, I hate to wrap up this discussion because it's so fascinating. And I know that my viewers are really gaining so much from your wisdom here. So for people who are watching today and they may be in the workplace and an aha moment went off for them, or they have a child who has been struggling in school and they've been trying to figure out just what to do to help that child, where should people start who have concerns about these things we're talking about, these maybe hidden visual disabilities, or maybe it's a parent? What's one of the first things that you would encourage them to do?
I would really encourage people to get a comprehensive eye exam. So you don't have to dive headfirst into therapy, looking for therapy. I would say the main thing is to get a comprehensive eye exam. Many people will take for word the pediatrician's offices to do, acuity tests on the wall.
Mhm.
However, I don't think that gives us the big picture at all about what our visual system is doing. If we are having visual symptoms, then I do think it is very important to have an eye exam, really see what's going on. At that point, the doctor can decide and tell you whether or not they think you might have a binocular vision disorder, and you should continue and maybe get evaluated and have a vision therapy eval. Or maybe they might just suggest glasses, and you might try the glasses out, see if those work. But I would say that the best place to start, of course, is a comprehensive eye exam, and most of the time the doctor will guide you through the rest. I would say ask about vision therapy. A lot of patients find us on their own. While some of them are referred, we get lots of referrals from other offices, even OT offices and things like that, concussion clinics. But a lot of good majority of our patients do find us on their own through their own research,
Yes.
finding these symptoms, realizing that they could be linked to vision, and then they'll come in and say, I want an eye exam, I want an eval, let's see if this can be fixed.
Yeah, and I think you're absolutely right. And this is why this show is really raising this awareness and shining this light, because a lot of times some people just kind of give up because they're just, I feel hopeless. I don't, nothing can help. I have glasses and I'm still not, able to comprehend or see what I need to see. And it is the person who perseveres and just knows their body so well that they say to themselves, it's got to be something that I cannot rest until I've turned every stone. I want to talk about accessibility, to people, because for some who are listening today, they might be wondering, are your services covered by health insurance, and how accessible would it be, to the population?
Yeah, so I know insurance is always a big hot button issue when it comes to therapy. So I will say it is not impossible to find vision therapy that is covered by insurance. For the office that I currently work in, it is about, I would say, an estimate, I would say it's about half covered by insurance. And I say this because the way that we bill for vision therapy, there is a code that is considered by the insurance company educational training. Because we do so much work with processing, and we do so many right brain, left brain activities, lots of also, physical and vestibular activities and therapies, they consider that more educational, so it's not able to be billed medical. However, there are other vision therapy offices that do bill vision therapy a different way, so it can be covered by insurance. It really does depend on, person, plan, policy, and where you decide to get your vision therapy.
That's good. That's so good. Is there any last minute wisdom that you want to give before we go into the next section or the next segment, which I'm going to ask you to stick around for, the Q&A portion, because, and this is a good time for you guys to put your questions in the chat or in the comment box. We want to be helpful to you while we have an expert here. Maybe you heard something today that resonated with you, or there are things that you are wondering about yourself. I truly encourage you to go ahead and share your questions that you want Gabrielle to answer for you.
Yeah, so I would say, what could I add? I'll say a little bit about like what people should look for. I know we touched a little bit on it earlier, but I also wanted to mention children that have issues with tracking, like we mentioned, reading lines of paragraphs, being able to keep their place, but also people who may have blurry vision or double vision. It might not always be because they need glasses. They may have
Mm-hmm.
an eye teaming issue, trouble copying from board. I know we mentioned that, but I also wanted to touch a little bit on the physical symptoms that might be a result of poor eye teaming or vision disorders. One of the main things we see, of course, is strained and tired eyes,
Mm.
avoiding near work, not wanting to do homework or things that are done up close. Headaches are a big one too, especially if they are children. I find a lot of children with headaches do likely have some visual issues going on. Headaches, mainly associated with near work, tilting of the head or
Mm-hmm.
closing one eye when they're doing work. Some
Mm-hmm.
kids, you might see them sitting like this, one hand over their eye, or tilting their head, or maybe they have to squint. Little
Mm-hmm.
things like that can often mean that there is something visual going on that needs to be addressed.
Mm. These are really good telltale signs that you bring up. And I imagine, even as adults, sometimes because we've been doing this so long, we may have missed the signs as children. We grow up and we're in the workplace and we're still doing a lot of these very same things to kind of accommodate, for what we're not seeing clearly. So these are really good physical telltale signs to really take note of. So I don't see any questions as yet. Again, you're encouraged to put your questions in the comment box or in the chat box if you're on YouTube there. And tell us what you're thinking about what we're sharing here. Is it of value? We would love for you to keep the chat going there and just kind of dialoguing with each other. So one of the things that I thought, Gabrielle, for this segment, we usually have questions that would come in from viewers that we might take one or two and talk about it here on the show for the benefit of the larger audience. But I thought that instead of doing that today, because this subject matter is so technical, I'd like to ask some questions that are apropos to this subject matter. So some of the
Okay.
things that a viewer may be wondering, you yourself may be thinking about this, is if a parent has a child who is diagnosed with one of these visual disabilities, um, where could the parent gain support from, let's say, the school system? Because this is really where it's going to show up, and it's going to show up in a big way in terms of how that child then navigates their school life.
Yeah, so we often will write accommodation letters for our patients, not only
Mm-hmm.
school children, but also adults who need accommodations at work. So after the evaluation is done, after Dr. Hawk has made her diagnoses, we will put them all on a page. We will come up with a list of accommodations that we believe that child um, could benefit from academically. So, like things we mentioned earlier, like bigger font, we may tell the teacher to eliminate desk to chalkboard copying. So, we may say, this patient needs or this child needs a printed out sheet of paper to copy from instead of copying far away from the board. We may
Mm-hmm.
say they need additional time for testing. We'll also put in there that they should be allowed to take visual breaks and things like that. Larger
Mm-hmm.
font for schoolwork, slant boards, which I don't think I mentioned too much,
Mm-hmm.
but a slant board is essentially a little whiteboard that we give out to our patients. It brings the surface up about 45 degrees, so it just gives a better viewing angle for um, paper and words on pages. Those can help a lot too.
Mm-hmm.
So yeah, we're always willing to write accommodation letters for our students to try to help as much as we can in the classroom. And most of the time, we find that teachers do comply. We rarely get too much pushback about those accommodations. Some patients will have an IEP and our additional vision therapy
Mm-hmm.
accommodation. So I do think that the school system is willing to make these accommodations for these patients as long as there is some sort of diagnosis or letter from the doctor.
Great. And I do know that some workplaces today do have special accommodation offices that adults can go to and bring these types of documentation to show that they do need accommodation at work to sort of help them. Give us one or two examples, maybe for an adult who's experiencing this. What would their accommodation look like in the workplace, depending on their diagnosis?
So for adults, accommodations, they may be the same. They may, depending on the person's job, we may say allow additional time for reports or allow this person to take a break and walk away from their desk every 20 minutes. We may ask them to adjust lighting, let this person work in a more dimly lit area. Larger monitors is a big one. So we like to get people larger monitors, not as big as we can, but we'll say the monitor should be at least, 38 inches across or so and so. And some accommodations also include working from home. If they are able to work from home, we'll make the suggestion that they should be able to at least a few times a week. We may say allow extra time for commute because that patient might need the ability to take their time when driving, right? Things like that.
Yeah, these are all just great information to know that you do not have to suffer in silence. Your child doesn't have to suffer in silence. All of these things are available to you. And tell us how we can find you. If somebody wanted to explore treatment of this sort, maybe through your practice or other areas. Later on, we are going to put some resources up on the screen. But for those of you who may be in this area, tell us how they can find you.
Yeah, so I can be reached by email. I would say that is the best way to contact me. My email is gjeffrey, so GJEFFREY dot CFEC@gmail.com. So that's gjeffrey.cfec@gmail.com. That would be the best way to reach me. We can also you can also give the office a call, Crofton Family Eye Care. If you ask for a vision therapist, if we're available, we'll be happy to pick up your call and answer questions. If not, we'll be able to send you a lot of information through email, and we can set something up to talk more about, things that you might be experiencing or anything that we can do to help.
Great. That's wonderful. Gabrielle, I am so very grateful to you for taking this time today, for being here and just giving us such valuable information in such a plain and understandable way. I know that I have truly gained so much just from hearing your responses, and I hope that the same for my viewers. In fact, I believe that they have. They've been listening intently, and just because we didn't get any questions, I don't think it means that they, I just think it means you did an awesome job really bringing this together. And so thank you. Thank you so much for being here. Thank you so much for your time. Thank you to Gabrielle Jeffries and Crofton Family Eye Care. We're going to put up her information on the screen later on, as well as some resources that you all can see. So we're going to go ahead and do a wrap up. I know you have more things to do in your day. So thank you for taking the time. And I hope to talk with you again soon.
Yes, thank you so much for having me. This was a really great experience, and I definitely enjoyed talking about this. And I'm really glad that we got to get into a lot of the little pieces that you don't hear very often. It is a very nuanced subject, and it's very different for everybody. So I do hope that if anyone has any questions, that they let me know. I'd be happy to talk about it more. And yes, thank you so much for having me. This was a really great experience, and I'm glad that you were able to share your platform and share your viewers with me so we can talk more about vision therapy.
It was a pleasure. Thank you. All right, you take good care.
All right, thank you. You too.
Thank you. So we gained a lot today, did we not? I am just so very moved. Again, this was not just a professional matter for me. This was also quite personal. And as we, go into our wrap up here, I want to just leave with you a word of encouragement. For me, I want you to really think about whether you have a hidden disability or a disability that's quite apparent to the naked eye. I want you to always remember that your disability is not an inability. And maybe you might need to write that down. Your disability is not an inability. You see, we are all just so wonderfully made for a purpose. And whether our eye does a dance and it doesn't always focus in and where it needs to be, or that we use some sort of assistive device to help us get around, we are all uniquely made and just as valuable. You see, in Matthew 6:22, the Bible refers to our eye being the lamp to the body. I truly believe that. Because to me, that means that it's a window into the light that shines within all of us. As a mental health professional, I'm no stranger to the trauma that many people might experience in their lives that sometimes leads to what looks like the lamp going dim or sometimes even dark. But when we think about the uniqueness of each of us as individuals, we must embrace our differences that we were born with. And maybe we acquired some of these differences along the way. We do our best to make the most of every gift that we've been given. And the conditions that whether we've been given them or we've acquired them, we must avoid turning off the lamp in our eyes, the very light in the eyes that leads to the soul. So remember this, as Sarah and Lane Coates once said, not all vision impairment comes with a guide dog or a white stick. Remember that as you walk along the way. And the very thing that you cannot see or sometimes don't take the time to understand or even to validate is what you need to take note of. I hope that you will remember to always be kind and compassionate to everyone that you meet because you never know what struggle the person next to you is going through. So I want to encourage you to take note of the resources we have for you here today on the screen. Remember, you can contact Gabrielle Jeffries at Crofton Family Eye Care located in Bowie, Maryland, if you're in the DMV. But if you're nationally located, there are many, many ways to find a visual therapist. And these resources on the screen might be able to help you in your quest and in your journey to find someone to assist you or perhaps somebody that you know and love. Thank you so much for taking the time to be with us today. We at Power Talks with the Talk Doctor featuring Ask the Talk Doctor Live want to always be helpful to you. We want to always bring to you all kinds of different subject matters to help you in your health, wellness, and mental well being. Remember that we ask that you like our videos, subscribe to our channel, tell a friend, tell two, tell a coworker, tell whoever, because we want to make sure that we're helping you one person at a time. Thank you again to our loyal viewers and listeners, and also to Gabrielle Jeffries for being here today. And we'll see you next time on Power Talks with the Talk Doctor, featuring Ask the Talk Doctor Live. Be well. See you next time. Bye now.